Hey, what's going on? This is Dr. Ben Glass. I'm a chiropractor. This is the Pre-Chiro podcast where we just aim to shine a light on the different paths you could take in the directions that you might want to go on your journey to become a chiropractor. Just by reflecting on what we did today, I have the privilege of interviewing somebody who, Dr. Kirsten, Dr. K, how long have you been doing this for now?
Well, I graduated from Parker in December of 2005, but I've been in the wellness realm for almost 25 years now.
Awesome. So you were someone who was in wellness before chiropractic. That's a great place to start. Can you just share what attracted you to becoming a chiropractor and what you were up to before chiropractic school?
Absolutely. I was a student at UT. I thought I wanted to become a cardiologist until a car accident changed my life, which is a story you hear from many chiros. Of course, the muscle relaxers and the pain relievers, had an adverse effect. I have a low tolerance for drugs and pain. And so if I took those, I was sleeping through class. And if I didn't take them,
Mm.
then I was in too much pain to go to class. One of my dorm mates, her father was a chiropractor, and she said, I heard about your accident. I think my dad can help you. And, at that point, I was at my wits' ends. I didn't know what was happening to me. I was about to fail out of school. And he actually changed my life. And he had a massage therapist that was on staff with him. He was the first practitioner to ever, touch me. He explained to me what was happening with my body. He helped me through that time. And it just really inspired me to do the same for others.
Mhm.
And I love the satisfaction he had. I'd never, heard someone whistling, when they would walk through the halls. Like I didn't even have to see him when I walked in. I could hear him. You could hear the joy that he had with what he did. And, I come from a family of healthcare providers. So I know that, the nurses and, my uncle's a kidney specialist, and their lifestyle was great, but they were always gone. And I knew one day I wanted to have a family. And, I said, let me check into chiropractic a little bit more. So my journey into massage therapy was my thought process behind that was the fact that I thought, oh, well, maybe I could not have to have student loans. I was really naive about it. And I thought that I wouldn't need to have student loans and that would pay my way through chiropractic school. It helped me make extra money. But my naivety, behind that, I did have to get loans, but it gave me a greater depth of knowledge of the body systems and the anatomy. I had that foundation. So it just really helped me with the process and gave me a better understanding so that I could help my patients better.
Hmm. What's most important to you right now? What do you enjoy most about practice? What do you enjoy most about life? And where's your heart at? Who do you care to help the most in practice these days?
So, as far as practice, I love getting and helping those patients that are hopeless because they, have thought that, their entire life, either, what's going on with them, they've been told has been in their mind. I get stories from across the board, students who, have been labeled, with these conditions that are general, and people that are just generally hopeless because they don't think that this pain that they're feeling will ever go away. So that inspires me each and every day. And as individuals, when they're in pain, oftentimes can be a little mean and not friendly. And to see someone smile when they are, they come and see you and they've seen all these different practitioners, but to be able to see that light get turned back on and that hope come back is priceless for me.
Hmm. Can you speak to that labeling and get deeper into the mindset that a chiropractor needs to be in, that doesn't follow the path of just reacting to the label and buying into what somebody's been diagnosed with and the prognosis that they've been given, and really having a strong enough mindset within, or a resilience to the medical imprinting on the consciousness of the people that come into our offices, to really be louder than that, not by voice per se, but just what we represent and who we are and what we're offering. How do you really meet people where they're at, but bring them into your way of thinking about how they're going to move through this as a way of healing?
Well, I think if we look at a common condition like osteoarthritis, knee pain, and if we look at the way that the traditional medical model treats someone who has degenerative joint disease in their knees, typically, they start off with the muscle relaxers and pain relievers. Then they'll go and see a specialist who usually that path will be steroid injections in their knees. And what the research shows, and one of the reasons why they can only have um, 3 injections per year, is because the steroids eat their joints, which then will lead them on the tract of having surgery, which can last 15 to 20 years because those replacements are not something that's permanent. And during this entire time, these patients are living in this pain cycle. And one of the things that, we found is, if we can educate our patients about getting help as soon as they start experiencing any type of pain or discomfort, then the goal in being able to help them can definitely, be achieved a lot faster. It can be more permanent, and it can stop the devastating effects that they may have, with the residuals of going through that standard process. And one of the things that, we were really fortunate in doing, and I have an integrated practice. So I have a medical director who's an internist. I'm certified in both massage and acupuncture, but we do have an acupuncturist who works with us on staff. We have a few massage therapists and a physical therapy assistant. So we do a lot of active rehab. We spend on average 45 minutes to an hour with our patients. So it's not a quick in and out. One of the things that I loved about chiropractic is there's so many different ways that you can display your art, your healing art. And, all we're doing is freeing up the body so that it can heal itself. But, you have to look at the other. One of my frustrations about the traditional healthcare model is that we compartmentalize care. And we all know that that's a sick care model. What about the wellness? If someone does have knee pain, we have to look at the joints above and below that. We have to think about the compensatory factors that are occurring with that. So you're not really treating the whole person if, you're going through the traditional model, you're getting a 15-minute visit, and the only thing that's really being addressed is their knee pain. That person that comes in my office, I see the whole complete individual. I'm not simply looking at their knees and their knee pain. Yes, that's your chief complaint, but let's see how the other dynamics are. And we've been able to market and co-treat patients with, other primary healthcare providers. We've also established relationship with pain management docs. And when we go in and educate them armed with their own research on,
Mhm.
okay, this is supposed to be temporary, these are supposed to be used in conjunction with therapy, and actually explaining what we do as, chiropractors, but also in our wellness setting, we've been fortunate to be able to bridge that gap within the community.
Mhm. So if I'm a medical professional and you're a chiropractor, coming to contextualize to me how you would work with my patients to co-manage, what are some things that you describe about your art of chiropractic and how you deliver care to people?
Well, one of the things that, I share with other healthcare providers is number one, that when you are prescribing these medications, it's not getting to the root cause when it's a neuromuscular skeletal condition. They are not the best in treating neuromuscular skeletal conditions. We just walk them through the process of what we do in our office. We keep them informed. We send them follow-up notes after the visits. We're able to show them some of the research and, give them, active testimonials from patients who may have been, addicted to opioids and who have been able to get off of them because their pain's been managed properly. And, we just ask them, send us a couple of your difficult patients that you have. And now, I think it's a great time to be a chiropractor as well, because now more than ever, patients are informed and they don't want to simply go down the pharmaceutical route of trying to manage what's happening, with their care. And we know the top, two reasons why people present to the emergency room is because of back pain or neck pain. Just looking at those two areas, and we do so much more. We just ask them, send us a couple of your patients that you're having a difficult time with, and allow us to co-manage their care. And I can guarantee you'll have better outcomes and greater patient satisfaction. And the next thing you know, you're getting referrals consistently from those providers.
What's some advice you would give to like a high school or college student that is trying to figure out what's the best direction to them? What would you tell them is different about chiropractic? It sounds like one thing I could touch on based on hearing what you've said is the mindset of how you see people holistically, and how you have been exposed to so much in the wellness world that it allows you as a chiropractor to be that primary care doctor that can direct them in different directions for wellness. Um, how would you describe to a high school student maybe what they could start doing today, aside from just shadowing docs and being in offices? What are some things they should start to involve themselves in? Maybe massage therapy, maybe personal training, maybe major in a specific thing. Any advice?
The advice I would have for any high school students or college students that are interested in being in, the healing arts profession or a chiropractor is number one, take anatomy and physiology. That is going to be one of the most beneficial courses for you to take. We work with a lot of professional and retired athletes as well. And if you're interested in sports, the personal training route will just add on to your gift. The greatest piece of advice is do what keeps you up at night and what you really feel passionate about. At a young age, sometimes that changes. Look at my story. I thought I would be a cardiologist. I definitely wanted to be, in healthcare. I know that a lot of high schools have programs now where you can be, with the team and learning how to do rehab and working on patients, kinesiology, and so, check it out, see what it's about, learn what you feel like you like. One of the great things that I love about what I do is, I can practice the way I want to practice. So there's so many tools, there's so many different additional training that you can get, whether you're interested in the brain and you want to become a chiropractic neurologist. If you like to do functional medicine like I do, and combining therapies with other practitioners, if you're interested, in being the athletic doctor for a team, there's so many different opportunities. Every major sports team in the nation every league has chiropractors that work with them. We have chiropractors that help our we have legislators. We have chiropractors that are right there, on the Capitol treating patients. So there's no limit. There's pediatric chiropractors. So there's prenatal chiropractors. Whatever you're passionate about, and if you want to have a career where you can treat people naturally and you can help them achieve their goals, it's a wonderful profession and the opportunities are endless.
Thank you for putting it like that. What are some of the major influences, the programs, whether it was postgraduate programs, specific certifications, books that you read, mentors that you had that still put out content or material that you could point students in the direction of? What were some of the specific things that really shaped you?
Some of the specific things that really shaped me early on, you talked about mindset and Think and Grow Rich. I read that. One of my mentors suggested I read that. And I read that while I was in my first year of chiropractic school. And I actually wrote out my goals for after I graduated and my vision for my practice. Knowing where you want to go and having a map of what ideally you envision your opportunity to look like is definitely a great way to start. Some of the programs that I attended, I did go through the prenatal chiropractic program. I'm certified in acupuncture. Already having the massage therapy training was valuable for me because, it gives you an opportunity to not only, be able to address more of the muscular component, but if you decide to incorporate that into your practice and you want to hire someone, what they're doing, is correct. I've taken advanced programs and done quite a bit of coaching throughout my career because we're always continuing to educate ourselves on, ways that we can better help individuals. You can always reach out to me or any chiropractor if you call them and let them know that you are interested in perhaps pursuing the chiropractic profession as a career. They will welcome you with open arms. Most chiropractors' offices are open. We are essential providers. So even during, the pandemic that we're experiencing right now, as long as you're responsible and you're masked up, call them first. They'll more than be happy, to welcome you into their office or sit on a one-on-one virtual visit with you and let you know what they do and answer any questions that you may have. I think anything that you can study that's going to be beneficial for you in a healthcare environment, whether it's biology, pre-med, those are, going to just give you more of the foundation of what you need. And go visit a chiropractor yourself if you've never been to one, so you can experience what the adjustment is, and you'll have an opportunity to see the different diversities in our offices as well.
Mm-hmm. You recently spoke on the Spinal Summit or Spinal Hygiene Summit. What was your topic and what were you sharing?
Well, I have back in 2018, I launched a CBD product line, and I've been utilizing that to not only help patients get off of opioids, but also help them manage their pain with something that's non-toxic. And I met and became a part of the spinal hygiene movement and met Dr. Tabor Smith. I watched his film A Better Way, which it's available on Amazon. That is something that everyone should do. Watch that film because it really discusses some of the changes that we're seeing in individuals because of technology and the degenerative changes that are happening even in children, and the ways that our traditional system has failed and what alternatives, or I prefer complementary healthcare because I think we should cohesively treat patients. What that can do, when we're looking at dysfunctions and not just medicating problems. So that documentary is something I highly recommend everyone watch. The spinal hygiene movement. He's created an educational tool that allows patients to have a home care kit, and you can guide them through utilizing these exercises in your office. But what I found is when I've combined the spinal hygiene kit with the pain stopper, I call it the ultimate home care pain relief kit. And what we've seen is more compliance from our patients. They're healing a lot faster. Their range of motion is increasing. And it's just been really enjoyable to see that. As far as my patient base, in addition to the athletes, I work a lot with seniors and veterans. And to see them, and especially the veterans, they've spent their entire careers, physically putting their body at risk for us. And, oftentimes I'm taken aback by some of the injuries that they sustained, but yet they kept moving on. And, to be able to help them again, when most of them felt like I'm just going to have to live with these physical ailments for the rest of my life, and it changes their life, and they start utilizing tools that you give them, and they'll come in and they'll say, look, I can turn my neck all the way, or, just the small goals that they've been able to accomplish to get that functional improvement is priceless. And if you're interested in a rewarding career, again, chiropractic profession should be something that you seriously consider.
Hmm. Well, I want to thank you so much for taking some time, keeping it real, sharing some insights, and really just being authentic. You're just sharing what's up with your practice, and I think that it's great because we haven't really had too many integrative representatives on here of what that looks like from a chiropractor standpoint. And so I just want to thank you for that representation. Um, yeah, that's great. I mean, this is us just really trying to be more transparent and also be more clear on some different directions they could go. You pointed them in many directions, so I want to thank you. What's your website and maybe your Instagram handle so that people could connect with you there?
Absolutely. My website is painstopinc.com. Instagram and on Facebook, we're at the Pain Stopper. And if anyone's interested, just reach out. I would love to have a deeper chat and definitely help mentor the future of our profession because it's growing, it's great. Patients seek us out, and it's one of those professions to where it's funny. I have a lot of colleagues that are medical doctors, and they're like, people are resistant to pay cash, for my services. And I said, yes, because of, the quality of care that they're getting. Not to say that, there's not a place for it, but for what we do, I said, whether or not their insurance covers it or, they're going to figure out a way because they find the value in our services. And I think that that's great, and that shows that, they seek us out, which is fantastic. So there's not going to be a difficult time for anyone to find patients if that's one of the things, that you're worried about. Just learn the skills, have a great personality, and most importantly, love what you do and do it for the right reasons. The money will come. So as long as you're on purpose and you're wanting to help someone heal and help change some of these destructive behaviors that we have with overeating and over medicating, then this is something that you should seriously consider. I appreciate you having me. This has been so enjoyable.
Yes, appreciate you too, Dr. K. Have a beautiful day.
You do the same. Goodbye.